married, and my husband works for himself. He has his own business with an occasional employee, but mostly it's just himself. And so we've had the neat arrangement for a long time that I was a full-time employee somewhere that provided health care. Either for him as my domestic partner in California, or as my husband, or as a full family. I was a federal employee here in Oregon for 7 years, and so I was under the federal health benefits plan with Kaiser. Needless to say, that's terrific stuff. You don't get better than that. Still a few things I could have improved, but it was terrific. I didn't realize, I don't think, quite how terrific it was till I left federal service on June 12th. One thing though, when you had mentioned that, everyone has a healthcare story, and I didn't think I did. I have a lot bigger one right now, but a few years ago, while a federal employee, we have open season. You can switch your plan every November, and the plan I was on at Kaiser, which was the high plan, the premium went up 50% from December to January, which led most of us to sort of freak out and spend an inordinate amount of time digesting information. I ditched the dental care. I just made a lot of changes. I had to lower the plan, even with great benefits. And that was a big surprise. There was no warning, no nothing, just 50% increase next month. So that was the beginning of a story. But when I left federal service on June 12th, I had coverage for 20 days, and then thought, great, fine, I'll go buy it, no problem. I have another job. I've had Kaiser for 20 years. I'll just go to Kaiser and I'll apply and I'll get it. And so I did, and I applied for 4 of us, having spent several days sorting through information and various plans, and how old's my husband and how old am I, and if we go on me and I'm younger, is that going to be a benefit, or is he going to drag us down? Should we separate and have kids here and parents here? And which is ultimately what we did. We applied for Kaiser mostly because it's just a known quantity for me. My husband and I applied for one plan. Children had a lower deductible. We chose a higher deductible, money reasons, and we just figured we're healthy, we know what's going on. You never know what's going to happen with your kids. I applied online, with like 5 days to spare before my federal health care went away. And this is aside from, COBRA and portability, which were available to me at a crazy rate, I will say. I'm glad it's available, but it was ridiculously priced. So 3 days later, I get the emails back. We have no pre-existing conditions. I was thrilled to know, but we do, which I didn't realize. So I applied for 4 of us, my husband, myself, my son Coleman here. Fine, no problem, you're insured, sign right up. My daughter Georgia, which was the first letter I opened on the email, was denied. She's 2. She was born at Kaiser. She's always been treated at Kaiser. And she was denied because she had been hospitalized during the year. She had nothing. And it's fine. They hospitalized her because they were concerned. I think it was a little bit of a liability thing. I understood that. We spent the night at Dornbecker. She's fine. No problem. We went to see some specialist. He was like, what are you doing here? She's great. Denied. I was flabbergasted. I almost fell off my chair. It just didn't occur to me. I just didn't think I had a problem at all. We're healthy. She's still healthy. So we've appealed. We may get it. I hope we get it. But I called to check in to see if they got the letter. Oh, that's right. It's loud. It takes 30 to 60 days, so what we need to do now is buy her sort of catastrophic insurance. She's walking uninsured right now. And the reason I left federal employment was to work fewer hours so I could be with my children more. So I work 20 hours now, which is why I don't have health care through my current employer. Their heart is very much in the right place. If I worked 30 hours a week there, I would have full benefits. And so I may do that because I need benefits, because my husband can't get them unless he buys them for us. So we're solidly middle class. We can pay our bills, but this is, these are high bills, and I negotiated a higher salary to be able to pay for some of this, but not all of it. And what I'm finding that's the most frustrating thing to me is the system is driving my decisions as an employer, as a worker, and as a parent. And I would like to make those choices myself. I would like to work 20 hours because I can pick him up from kindergarten at 2:30, and that's what I want to do, and that's why I reduced my hours. If I work 30, we're going to have that crazy family life where my husband leaves at 6, I go at 2:30. It can work. It's not ideal, but we'd be making that choice specifically to get health care. And it just doesn't make sense. And so the concern I have about the candidates' different proposals is that, I don't necessarily think everyone should have to get their health care through their employer, but that's kind of the system that's working right now. And those of us who are left out of it are really left out of it. And not only is it harder to get it, like for my daughter Georgia, but what you can get is just different. The federal plan, the federal plan, and I asked Kaiser, and this is a minor thing, but my husband has a bad back, he goes to the chiropractor federal plan, self-referral, copay, as much as you want. And I asked about, well, if we wanted to get chiropractic and we're buying this ourselves, how would that work? Not available. Well, what about on the lower end? What if we went with the platinum plan? Not available. You know, it's a minor thing. I realize that is not a huge issue, but it started to make me think, wow, like there's just stuff that's not available to me, even if I wanted to pay it. Why is that? Why am I different now than I was 6 weeks ago when I was a federal employee? It's not. And so I'm having a different eye on the whole system than I did before. And my concern about forcing the McCain plan, for example, of forcing more people into the private market is, you know, the stories that these representatives are telling about the battles that they fought to get what we've got are great and inspiring, but terrifying that we have to fight like that for all these little things. And if that's what it takes to get those things, and we're going to leave us all to the private market where the insurers are deciding what we get and don't get, I'm a little terrified. I don't want them making those choices for me. So anyway, hopefully my daughter will get approved. We'll all be happy in about 6 weeks, shelling out a lot of money. I'll probably start working 30 hours a week, have a little bit of a crazier family life, so that I can, you know, kind of bring home that piece of the family pie. So, thank you.
Our next story is Adela Maza, and Adela is a janitor and is a member of SEIU Local 49, and the union actually just negotiated health care benefits for the children of janitors, and so it's really kind of an exciting time, and we're really happy that Adela is here. And did your son go? Is he still sitting there? To talk about what that really means in their life.